Polycystic ovarian syndrome, or PCOS, is associated with many symptoms, including irregular menstrual cycles or a lack of periods altogether. And this is generally associated with a lack of ovulation or release of eggs. Many of the women have hirsutism or excessive hair growth, acne, weight gain that goes hand in hand with this. So we see considerable amount of infertility associated with this condition. There are also health risks associated with it because of hypertension, cholesterol problems, so it's a significant disorder. We know that the underlying problem for PCOS is related to abnormal insulin function, where the body just doesn't handle insulin properly and the women have excessive production of insulin. This then contributes to excessive production of male hormone as well, which then has a very bad effect on egg quality as well as ovulation. There are specific identified ways of making a firm diagnosis, and this includes 3 different assessments. And if 2 out of 3 are abnormal, that's what defines PCOS. So for example, we will do an ultrasound at a specific time of the month to look for polycystic ovaries. Number 2, they have to have a history of irregular or lack of periods. And number 3, either excessive male hormones, or when we measure the male hormones called androgens, they're elevated. So if 2 out of 3 of these categories are abnormal, and we've also ruled out thyroid and adrenal diseases, that's what makes a diagnosis of PCOS. The treatments for PCOS, and clearly the best way to achieve a pregnancy, is I always like to start with my patients talking about lifestyle issues, because there are many things that the women can do themselves to significantly improve their chances. The woman has to be able to improve her weight, her carbs, her metabolism, and the key here is lowering her insulin levels. So we encourage exercise, and honestly, whether they have weight loss or they exercise, they're both very, very beneficial. The results in treating the PCOS patients are not just gratifying, but it's so rewarding because you see a transformation in the patients because they've contributed themselves. When a woman loses weight, when she's been exercising, her self-esteem goes way up. She knows she's contributed to the success. It doesn't work any longer to just come in and say, "Doc, you got to fix this," and it's that simple. Well, no, it doesn't work that way with PCOS. It's a team effort between myself, the patient, and the rest of our team.